My name is Todd Wiseman. I am a 54-year-old, relatively healthy, active male. I have an issue with my arm. They call it tennis elbow, but I actually got it weightlifting. I don't even play that much tennis, but I do lift, and I did injure this elbow and arm, and I felt it right away. And when I was trying to hold hand weights, anything over 10 pounds, I couldn't do it. And then I went fishing and caught a bunch of 30-inch snook, and holding that rod with this hand and fighting those snook, the next day I was really, really inflamed and really in a lot of pain. To add insult to injury, I played tennis with my daughter. I could play tennis, but when I went to serve, trouble. So made the decision to go ahead and get a Novamax Exosomes injection at one of the orthopedic companies down the street, offices down the street. A highly trained injection surgeon had decided to take my case, and I'm heading over there now to get the injection. He evaluated me first. I went in for the evaluation. They actually took an x-ray, but the x-ray showed everything was good, and because of the inflammation and the pain, I was an excellent candidate for the Novamax Exosomes injection. So that's what we're going to do.
Exosome-derived materials that we use for our scientific platform technology, it's protein-based fluid. We have 771 different cytokines, chemokines, growth factors, as well as a natural hyaluronic acid. Those proteins, they work together in conjunction with the body to stimulate it. What happens is the cytokines work towards the anti-inflammatory response that's necessary to bring down inflammation, which then allows the chemokines to trigger the immune system to begin the healing process. And then finally, once you have your inflammation under control, you've got your healing begun, the growth factors can now stimulate the stem cells so that you have the highest potential for regeneration of tissue. The hyaluronic acid in all instances is going to help with lubrication and cushioning of that area to provide comfort and a little bit of easement of pain. So the exosome-derived materials that we utilize, they're going to be much smaller. These proteins are significantly smaller than a standard cell or molecule, so they actually have the ability, depending on where they're injected, they can go places that cells cannot reach, cannot get to sufficiently to be able to trigger any sort of a healing, or in the case of cells, if you're trying to do some sort of engraftment, it's not going to be successful.
Okay, I'm back. I've gone to the doctor and had my Novamax Exosomes injection directly into my elbow, and the doctor just froze, did a little spray and did an exterior freeze, and then it was one penetration of the needle, and then he, under the guide of ultrasound, moved around in the space and injected 1 cc of the Novamax Exosomes combined with 1 cc of saline, and he hit the spot. I knew he was on it, and I could feel it throughout my entire forearm, my thumb, my pinky, and here it's been, I don't know, maybe 30 or 40 minutes later, and I can really still feel the activity. As I understand it from the doctor, it's the anti-inflammatories, the cytokines kind of moving in and getting the inflammation down, and they're doing battle in there. And as soon as that settles down, then that'll trigger the chemokines and the growth factors and sort of the regenerative process in my, what they call tennis elbow, but essentially it's just a lot of pain in my forearm. It's now been 4 weeks since my first Novamax Exosomes injections in my forearm to treat what's commonly known as tennis elbow. The second injection took five minutes. The third injection, 5 minutes again. Now I have complete and full recovery of this arm for tennis, for fishing, where I couldn't pick up a water bottle. I couldn't even pick up a water bottle when it started. And now I'm back to lifting dumbbells, barbells. I have complete mobility. I have absolutely no pain in my arm or my elbow as a result of these Novamax Exosomes injections. To put it in perspective. I've been athletic most of my life. I was a D1 college pole vaulter and decathlete. I never enjoyed rehabilitation. I've gone when I've been injured. In this case, I didn't go to 1 second of rehab. I'm not saying you shouldn't go to rehabilitation, but I'm just saying in my case, I really didn't want to go. I didn't need to go. I got 3 injections of the Novamax injected perfectly into my forearm, and I'm back 100%. I couldn't recommend it any higher than what I do right now.